Hey, how you doing? My name is Angel, and this is my presentation for instructional on the renal system for my pharmacology class 130/8. So what we're going to be talking about is the renal system. So now we move over to and we ask ourselves these questions: what is the renal system? So what I have for you here today is also, if you want to pay attention to my lower left screen here, I have a video, or not a video, a picture of what it looks like. So, what is the renal system? The renal system is an organ system that includes the kidneys, where urine is produced, and the ureters, bladder, and urethra for the passage, storage, and voiding of urine. So if anybody knows, if you see the kidneys here on the left and the right, kidneys, they're like a pair of bean-shaped organs which filter blood and produce urine. So they also move waste controlled, the body's fluid balance, and keeps the right levels of electrolytes. So it's kind of a balance of fluids and everything. Kidneys are most complex and critical part of the urinary system. So the ureter kind of runs, the ureter runs like urine passes from the renal tube through the tube called ureters and into the bladder. So just it's like a process that keeps going. So then when it goes to the bladder, it's stored until the urine is allowed to pass through the urethra and out of the body. So, and the urethra pretty much, the duct transmits urine from the bladder to the exterior of the body during urination. So whatever it collects from waste, it just puts it right out of the body. So making sure it's like regulating other things, just making sure that collects waste. I think most of the stuff it like trying to keeps balance is like water, potassium, and sodium. So that plays a major role in the human body. Didn't think that did all that, huh? So now we move on to the six functions of of the um, of the renal system. So we could start off. So removes waste products and medicines from the body. So like I said, always, blood's being filtered. And then it goes, and then we move on next. It also balances fluids, like I said, water, potassium, and sodium. Uh, balance. It also balances a variety of electrolytes. So keeping all of those. Also releases hormones to control blood pressure, release a hormone to control blood cell production, and help with bone health by controlling calcium and phosphorus. That's also a plus too. So we're moving on to the next slide. That is the sixth function. So feel free to dive into, and if you have any feedback, Mrs. Graham, I'd really appreciate it. Okay, thank you. So now I got a list here. So it's like the process kind of. So we got nephrons, tubular secretion, and then we'll talk about intraoperative diuretics that's the third topic. So let's move on to the first. How the kidneys filter blood and excretion. So if we pay attention to the lower left, you can see that I got a diagram or a picture of the nephrons and the whole process and everything. So it's simple. Blood is brought through the afferent artery, arterial into the glomerulus. So, and like I said, if you pay attention, you'll see all of it functioning here. So through the glomerulus is a filtration system that pushes the blood through the perimal membrane. Any molecules that do not pass through are reabsorbed into the bloodstream through tubular reabsorption to the convoluted tubule. So, um, that's a process. So this is like the start and how it starts to collect waste and get ready to filter it and everything. So let's see. All right, so let's move on to the second part. So um, where are we at? All right, so filtered blood is then returned to the circulatory system through the efferent arterial. So once the blood is clean, it's circulated right back. So that's a pretty unique process. So if you can pay attention here, you see where everything goes here. So it starts through the afferent, like afferent with the A. And then by the time the blood has been filtered, then everything's been removed from the blood, it's returning through the efferent arterial, so interesting, huh? So now we start with tubular secretion. Sorry, I had like a little mishap with the, with the slide and everything. So the next part of the renal excretion process is tubular secretion, which involves the active transport of substances such as potassium ions, hydrogen ions, creatine, a waste product resulting from muscle metabolism, and urea, a waste product resulting from protein metabolism, from blood surrounding the tubule into the filtration, the filtrate. Tubular secretion, which takes place as in the convoluted tubule, eliminates waste products from controlling blood while controlling blood pH. Additional water is reabsorbed when filtrates uh, come back to the collecting ducts. Filtrate is emptied from the ducts into the renal pelvis to the ureter and bladder, excreted as urine. That's kind of like I want to say like the third process and how things go. Second maybe. So it goes from the kidneys. Um, so I think after it's like, so I think when you look at it, I think you could finally say like the whole process is it comes up, goes through the afferent atrial arterial, and then into the glomerulus, and then after it's all filtered out, that blood goes through the efferent arterial, and it's going back into the circulatory system where all the stuff, when it was cleansed, is now going into the tubular secretion process. So, and then into the bladder for storaging until it is drained through the ureter and out of the body. So, and like I said, that also that maintains the whole point of the renal system is to maintain homeostasis. So making sure blood pressure is good, it helps regulate that, making sure fluids is balanced. So that's does some amazing work. Mm. All right, so now we move on to intraoperative diuretics. So I think maybe like in surgery, it's based on like how like I think the length, like like how long the procedure is, the surgery is, because I know like kidneys are like if you don't take care of them, they can be very you can get very angry at you. Let's just say that. So in surgery, I'm guessing that sometimes fluid has to be pushed through the kidneys just to make sure, to maintain everything still. So let's go on real quick to intraoperative diuretics. So the use of certain diuretics to diurese a patient intraoperatively depends on long or short-term use of diuretics, and that can determine through potassium serum levels. Some diuretics can affect the level of potassium in patients during surgery because they can be hypo or hyperkalemic. So if to get a better understanding, so sometimes in surgery, I think people have to have they have to have their potassium levels checked, because they can. So what happens is if you have a low, um, if your patient's potassium is low, they are what they call hypokalemic. And so what happens is it's like a lot of trippy things happen, but one of the main things is muscles don't really work, and then being under anesthesia, which puts out like general anesthesia, what puts out muscle relaxants, so that's kind of not good. So pushing diuretics through surgeries also, that helps the kidney still maintain while in surgery. So, and pretty much like onto the second part, the only diuretic administered from the sterile back table is mannitol, which is contained in the ophthalmic medication. Mannitol causes a change in the osmolarity of blood, drawing interstitial and intracellular fluid into the bloodstream. This action eventually increases the amount of fluid secreted by the kidneys. Mannitol may be used to protect kidney function by protecting kidney functions by increasing the volume of fluid entering the kidneys. Also used in treatment of malignant and hypothermia. So basically, mannitol is kind of like it's an osmolarity, like an osmolantic diuretic. So it pulls. I believe that's what it means. It pulls fluid to it, and that's how it helps it. Yeah. So it's kind of complicated, but still, even during surgery, you still need to have these done just to make sure things are okay. Um, my next slide video I have for you here is my work cited video here. So there you see I've got Pharmacology for the Surgical Technologist, 5th edition by Evolve and the University of Rochester Medical Center. Thank you both again. I really appreciate the two sources that I was able to use to complete my assignment here. Um, I feel like I was able to get as much information I possibly could, and I want to thank them personally too, with this video. So I want to thank the University of Rochester Medical Center for helping me give me information on the renal system and to really understand it. And I also want to thank um, Evolve for having the textbooks that we have for surgical technologies, like the pharmacology for the surgical technologist. I appreciate it. Now, I want to thank the authors, Tiffany Howe and Angie. I believe it's Angie. Let me see, one second. And Angie Burton, because they provided great information. So again, like I said, it's Pharmacology for the Surgical Technologist by Evolve, the publisher's Evolve, 5th edition. I want to thank them very much. I really appreciate it. Their book has helped out, through so far. I mean, in pharmacology. Thank you. I just want to say thank you. Much appreciated.